In 1985, former Assistant Surgeon General of the United States, Dr. John Green, who at the time was the Dean of the Dental School at UCSF, the former State Dental Director, Dr. Bob Eisman, and Joel Boriskin, a local dentist, came together and had the idea of creating this organization that could advance knowledge and support public education and public policy to improve the oral health of the most vulnerable populations. The mission statement of the Center for Oral Health is to improve oral health through innovation, research, education, and advocacy. When we think about innovation, we're trying to develop healthcare delivery systems for the dental healthcare needs of the most vulnerable, that are cost-effective, that are sustainable, and that are inexpensive. We are currently providing comprehensive dental care in school sites at a cost of about $90 per visit. When you compare that to the actual cost of delivering a dental visit in a traditional dental clinic, which is hundreds and hundreds of dollars, we're innovating on how we're building community, on how we're building value, and how the community embraces the work that we are providing, the services that we offer in where they live, where they play, where their children go to school, and how that is linked to improving the academic outcomes in the public school system.
There's been a paradigm shift in dental care in which prevention is key, and at this point we're trying to eliminate direct restorations and active clinical restorations and just really focus on the prevention. The student doesn't have to use up the time in the day because they have the clinic here on campus, and the mother doesn't have to take off from work.
The value of completing as much research as possible lies in the fact that without that data, it's impossible to formulate common sense public policy. We are at the forefront of documenting the oral healthcare needs of older adults and then looking into how that translates and correlates with other chronic diseases that are very relevant and very prevalent in that age group. We organize an oral health symposium every year where hundreds of healthcare professionals are coming and finding a common ground to learn about oral health. And not only oral health in isolation is a symposium that it's interprofessional, so we blend a mix of healthcare and public policy professionals. We have dentists, we have hygienists, we have physicians, we have nurses, physician assistants. We start dissecting the issues that are impacting the quality of healthcare, the sustainability of healthcare, and particularly the impact that oral health has within the healthcare system in the United States. We're also educating the public, we're educating policymakers, we are educating every person that is in a position to make a decision. Advocacy is what allows us to become the voice of the voiceless. We become the voice of those children that are in a public school without a dental home. We become the voice of our grandparents who depend on a coverage from Medicare that doesn't exist. We organized in California a network of oral health experts. We have over 75 organizations and individuals that come together every quarter. We educate our legislators about the oral healthcare needs of their constituents. It is very important for us to thank all of you who come year after year to support the mission and the work of the Center for Oral Health. I also have to thank my staff. I have an amazing group of individuals that come to work every day with a smile, with a good attitude, and with a dream. We thank you very much for your support.